Good afternoon, everyone. It's my pleasure to welcome you to today's webinar, A Day in the Life of a Public Health Nurse. My name is Ian Culbert, and I am the Executive Director of the Canadian Public Health Association, and I'll be moderating today's session. Now, before we get started with our main event and welcome Deborah Veal, who will share her experiences and career path as a public health nurse, let me tell you a little bit about the Canadian Public Health Association. Our raison d'etre is really to be an advocacy organization that develops evidence-informed public policy alternatives and then advocates for their adoption by different levels of government. So in that we speak for people and populations and not for a specific profession. We champion health equity, social justice, and evidence-informed decision-making. And we do that in coalition with other organizations and in strong connection with our broad membership base. We leverage knowledge, identify, and address emerging public health issues. We do our best to connect diverse communities of practice, and we promote the public health perspective and evidence to government leaders and policymakers. We try our best to be a catalyst for change that improves health and well-being for all. Our vision is a healthy and just world, and our mission is to enhance the health of people in Canada and to contribute to a healthier and more equitable world. Now, a couple of years ago, we launched a new strategic plan that takes us through the 5 years of 2016 to 2020. And it identified 6 strategic goals that we hope to achieve. That CPHA is recognized as a national independent evidence-based voice for public health in Canada, that we do a good job of representing the public health community's interest in public health system renewal, and that we bring together partners to identify solutions to public health issues. We also want to ensure that we continue to have a dynamic, engaged membership and are always on the lookout for new ways to involve members in our work. Of course, none of this can happen if CPHA isn't financially and organizationally resilient and sustainable. And that ultimate goal is that we inspire and motivate change in support of health equity. As mentioned before, this is the final webinar in a monthly series that I hope that you've been able to enjoy different sessions on. If you missed any of the previous sessions, recordings of them are available on CPHA's members portal. As mentioned, this is this year's final webinar, but we will be relaunching the series starting again in September. So, a couple of housekeeping items. How does this all work? We hope to keep you engaged throughout the webinar. So if you need to send some instructions to the speaker to speak louder, softer, speed up, slow down, you can do that. There is a little icon of a person holding the hand up in the air. If you click on the arrow beside that, you can choose a few different options as far as what message you'd like to send to us. All of participants' sound is turned off, so if you have any questions, we encourage you to use the chat box to pose your questions, and we'll do our very best to answer those towards the end. And Deborah can identify if she wants to answer questions as she goes, or if she would like to hold them until the end. And finally, just as I mentioned before, the session is being recorded, so you can access it at a later date. Of course, anyone who is tweeting, feel free to use the hashtag CPHA webinar. So now on to the main event. Today, our speaker is Deborah Veal. Deborah is a registered nurse. She holds a master's in public health from the University of Waterloo and is a certified community health nurse. She has served on the boards of Community Health Nurses of Canada and provincial and territorial public health associations. Deborah's experience includes a range of public health nursing practice in British Columbia and Nunavut, as well as leadership, education, and currently public health nursing entrepreneurship as the Chief Executive Officer of Borealis Community Health Collaborative in Yarmouth, Nova Scotia. Welcome, Deborah, and I'll turn the microphone over to you.
Thank you, Ian, and thank you everyone for joining me to explore this dynamic career at the intersection of public health and nursing. Hashtag yes, this is nursing. And thank you, Ian, and the Canadian Public Health Association for hosting this webinar series. I think this is a great opportunity for people to explore careers in public health, to learn a little bit more about what these careers entail and what it takes to enter one of these professions. I'd also like to thank the Community Health Nurses Association for inviting me to represent the profession. I think it's also important to acknowledge the people and the land because truth is the first step toward reconciliation. So I make this acknowledgement to recognize the historic and ongoing legacy of colonialism. Nursing is a reflective practice, and it's important for us to take time to reflect and recognize these truths. We have a long way to go for truth and reconciliation, and I believe that public health and nursing, with our emphasis on social justice and equity, have a role in the implementation of the truth and reconciliation calls to action. As a child of the children of immigrants, like many in Canada, I didn't learn the true history about First Nations, Inuit, and Métis people in Canada, even though I lived in a community that was neighbored east and north by First Nations reserves, and there had actually been a residential school right in the community where I grew up. I did learn, however, that Columbus sailed the ocean blue and discovered, quote, discovered North America, and I learned about English and French settlers. So I think it's important to acknowledge the land and the people. I'm speaking to you today from what is now known as Yarmouth in beautiful southwest Nova Scotia, and I'd like to acknowledge this land as Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. The territory is covered by the Treaty of Peace and Friendship, which was first signed in 1725. The treaty did not deal with surrender of lands and resources, but in fact recognized Mi'kmaq title and established the rules for what was supposed to be an ongoing relationship between nations. Today we'll talk about what roles do nurses play in public health and how do nurses specialize in public health. So we'll talk about the foundations of public health nursing practice, the values, principles, and theories that underpin public health nursing practice, qualifications and competencies, which will be important for people who are looking to enter the field of public health nursing. We'll talk a little bit about the roles and standards of practice for community health nursing and public health nursing, and a little bit about professional development, which would be good for currently practicing public health nurses or those hoping to enter the field. And I'll share some of my story and stories of other public health nurses to help bring this information to life and to let you know why I love public health nursing. I want to acknowledge the work of Community Health Nurses of Canada in advancing public health nursing, and they've done a lot of work, literature reviews, environmental scans, face-to-face and other forms of engagement of public health nurses, community health nurses, and employers across the country in order to clarify public health nursing roles and community health nursing roles and to develop competencies and standards of practice. So before we get too far, I'd like to know to whom I am speaking. So I have two poll questions to give me a sense of who's on the call. And the first one, I'd like to know, where are you from? So if you can just answer from what province or territory you're calling in from. I was born and raised in Ontario, and I've lived and practiced in BC and Nunavut, and now in Nova Scotia, as Ian had mentioned. So I've kind of been from coast to coast to coast. So we have people from Alberta, Nova Scotia, Northwest Territories, Ontario, and Quebec on the call. So great. To know who I'm talking to. And the second question is, in what area are you working or studying, recognizing that some of you will be students? So I had a career in human services, management, and education prior to entering the field of nursing and public health nursing in particular. And as Ian said, I worked as a public health nurse generalist in northern BC, a public health nursing supervisor in Nunavut, and I'm now a public health nurse entrepreneur in Nova Scotia. So, okay, a lot of us are already working in public health. We've got some MPH students, welcome, and some RN students, awesome, thank you, and some others. Maybe I could have had some other other options there, but great. Now I have sort of an idea of who I'm talking to. So when people think about registered nursing or public health nursing in particular, people have sort of preconceived ideas of who we are. Typically, when people think about nurses, they think about people working in hospitals. And when people think about public health nursing, they think about three things: um, immunizations, communicable disease, and home visiting. And both nursing and public health nursing are so much more than that. And so I'll just get into a lot about who we are and what we do. More important than what we do actually is who we are, and we'll talk a lot about that in our conversation today. But if you think about the essential functions of public health nurses do all of that. We function in all of those areas of public health. So health promotion, disease and injury prevention, health protection, health surveillance, population health assessment, and emergency preparedness and response. We have a part in all of that. That's some of what we do, but as I said, who are public health nurses? Public health nurses are nurses, and we're specialist nurses, so we integrate nursing and public health core competencies to impact public health. Sorry, I didn't mention, if you have comments or questions along the way, feel free to put them in the chat and I'll try and glance over once in a while. And then we also have time for questions at the end of the presentation, so we can do either one. So when I say specialist, I mean public health nurses are highly skilled nurses. So all of the skills and clinical skills, caring, nursing theory, ethics, competencies, professional accountability that you think of when you think of nursing, that all applies to public health nurses because we are nurses. And then we combine that with a focus on population health. So that also includes all of the population health sciences, epidemiology, statistics, community development, understanding of social and behavioral sciences, health promotion. So all of that is combined in a public health nurse. Public health nurses work in collaboration and partnership with individuals, families, organizations, groups, communities, and systems in various settings to prevent illness and injury, protect and promote health. We do that by providing clinical services, by engaging in health promotion, by surveilling population health trends and emerging issues. We advocate, we work in the policy arena, research, and formal leadership roles. So public health nurses, as nurses and working in public health, have a huge role in addressing social determinants of health. And as I said, public health nurses are nurses. So as nurses, we are one of the most trusted professions in poll after survey after poll. Nurses hold trust at the individual level, at the community level, at the systems level. Nurses are very trusted. So that means something. Additionally, nurses are uniquely positioned in relation to individuals, families, communities, populations, and systems. So we often work with individuals and families. We often work with communities. We're embedded within communities and populations, and we're embedded within the health system. There are a huge number of regulated nurses in Canada, roughly 400,000 in 2016. This is from the Canadian Institute for Health Information. That includes registered nurses, licensed practical nurses, and registered psychiatric nurses and nurse practitioners. But the bulk of that 400,000 are registered nurses. In 2016, almost 16% of the registered nursing workforce worked in community health. So almost 27,000 full-time and almost 18,000 part-time. And additionally, there are almost 900 certified community health nurses in Canada currently. So public health nursing is a dynamic, exciting career. We have many different focus. So as I said, a lot of people think of public health nurses, they think about maternal child health or immunizations. You might also think about harm reduction. There's street outreach nurses in Vancouver, for example. We also work in mental health and addictions, social determinants of health. In Ontario, there are actually nurses with the title social determinants of health nurse, whose primary role is to address the social determinants of health for their health unit, and that's very exciting. We also work in education and health promotion. And how we do these roles is different in different areas. So Public health nurses can practice as generalists. And this is what I did when I was working in northern BC. I practiced as a generalist. I was in a rural, remote area in northern BC. And if you're from BC, a lot of people in southern BC will say, "Oh, from someplace that's really not northern BC." I was 3 hours north of Prince George, so I was really northern BC. And it was as I said, a small, rural, remote community. And we were a satellite office of a larger center in Dawson Creek. And as a public health nurse, I provided public health nursing services to my community as well as two other smaller communities in the area. So this included, yeah, maternal child health home visiting, so visiting moms who just had their baby and were bringing them home for the first time. Doing that assessment in that setting, you're doing health promotion, you're doing an environmental assessment, you're promoting and protecting and preserving breastfeeding, um, you're making connections to other services in the community, um, and then assessment and early childhood assessment and immunization services. And a lot of people, when they think about public health nursing, their only experience with a public health nurse is the needle lady. And I remember people calling me the needle lady. So they think about immunization services. But there's a lot more that goes into an immunization. When somebody comes to your office for an immunization, there's also the assessment point and the health promotion, and you're evaluating and assessing for social determinants of health. You're making connections with community resources and services. Um, and there's also community development involved as well, because you're surveilling, you're watching for trends and issues that are coming up over time, and then you'll be connecting with other stakeholders in the community to kind of address and solve some of those issues. I was also involved in comprehensive school health, so that involves working with schools to establish healthy public policy, to making sure that the school is a healthy, safe environment, training and capacity building with students, with families, with support staff and teachers as well as delegated nursing care for students who needed advanced nursing support. So comprehensive school health is a big part of what public health is, generalist public health nurses do in the community, as well as the school immunization program that people are more familiar with. Communicable disease control. So in my setting as a generalist, I would do the contact tracing and the follow-up, and TB as well. We would do TB contact tracing and follow-up, and as well as responding to other outbreaks that would happen in the community to do contact tracing and follow-up. And along with all this, we were engaged in health promotion at every level, from individual, family, community level, and community development. So forming those partnerships and collaboration with other stakeholders in the community who had an interest or potential to have an impact on health. And then often in larger centers, public health nurses will work in more focused practice as opposed to generalist roles. And so they may focus on specific developmental stage, like maternal child health, or they may focus on specific health issues, like sexual health, or they might focus on a specific population, like people who experience homelessness or people who use drugs. So for example, in British Columbia, there are nurses who can specialize, they can attend some courses at BC Institute for Technology, and they can be certified to manage sexually transmitted infections and contraceptives. And so they can, in addition to contact tracing and counseling and reporting, these public health nurses can actually do the testing, diagnosing, and treating of STIs as well as providing contraceptives. So that's just two sort of different ways that public health can be practiced, generalist and more focused practice. And sometimes public health nurses work in nursing teams, and you'll see this back when we had the H1N1 outbreak. We had huge teams going out into the community to do outreach clinics, outreach immunization clinics. Sometimes public health nurses are embedded in primary care teams, which is the new model that's being practiced in northern BC and across BC. Public health nurses can be involved in case management or in family-centered care. So there's different processes that nurses use to deliver public health nursing services. I also want to acknowledge that when we talk about who are public health nurses, this really varies. It's broad and deep and wide, the roles that public health nurses play. even the qualifications and what public health nurses are called can vary broadly across provinces and territories because of how healthcare is funding, how the healthcare funding works. There are differences between provinces and territories and different jurisdictions. So, as I said, in some areas, public health nurses may function at a broader scope of practice, like the BC's doing sexual and reproductive health services in BC in clinics. And I think this is a great model because it's a great example of how public health nurse practice can be leveraged to improve access to services. Public health nursing is also expanding to include other nursing professions in addition to registered nurses. So PHNs can be licensed practical nurses, RNs, nurse practitioners. When I was working in BC, we had tried to hire an LPN into public health, but we ran into some barriers with the licensed practical nursing college at the time. But when I got to Nova Scotia, I was thrilled to see LPNs working in the immunization program. And I think it's really vital that that all professions are utilized to full scope of practice in order to have a sustainable and accessible healthcare team. So despite these differences between the different jurisdictions, public health nurses all have things in common. We all share a common foundation, and so we'll focus a little bit on that now. So to understand who public health nurses are, we really need to understand the values, ethics, and principles that underpin our professional practice. And these are very clearly articulated in and reflected in a number of policies and guiding documents. I'll just throw out a couple of examples. There are several more, but Canada Health Act, the Declaration of Alma-Ata, the Ottawa Charter for Health Promotion, the Jakarta Declaration, the PEI Declaration. So PHN practice is continually evolving in response to changing needs, a changing environment, and advances in knowledge, but it's firmly grounded in our shared values and principles. And these come from many different sources. So for example, public health values that are reflected in the CPHA core competencies include that commitment to equity, social justice, and sustainable development, the recognition of the importance of the health of the community as well as the individual, and the respect for diversity, self-determination, empowerment, and community participation. And our values also come from principles of primary health care, which, as you know, include accessibility, public participation, health promotion, appropriate technology, and intersectoral cooperation. And since we're nurses, our nursing values include caring. They also include multiple ways of knowing. So nurses, we recognize that knowledge comes in different forms. So it might come from research, but it also comes from evaluation studies. It also comes from traditional Indigenous ways of knowing and other cultures' way of knowing. And as nurses, we incorporate that into our practice and recognize the value in that. We form partnerships with individuals and communities, recognizing that individuals and communities need to be active partners in all the decisions that affect their health and well-being. And that builds on that multiple ways of knowing. There's that expertise that exists at the individual and community level that needs to join with the competencies and expertise that we hold within public health and within public health nursing in order to change outcomes. And of course, empowerment, recognizing that empowerment is a process where people move towards increased control over their own lives. And of course, the Canadian Nurses Association Code of Ethics for Registered Nursing. We can't not talk about that. The new code, or the updated code in 2017, was just published, and that's found in the reference list. The code guides all nursing practices in all contexts and in all domains. So it guides our decisions, our ethical decision-making and decision-making in general. And also it lets the public know what they can expect of nurses. So if you haven't already, I do encourage you to look at the updated Canadian Nursing Association code. It is available online. And if you're already a registered nurse and you haven't read it, should read it. And if you're not a registered nurse, you should read it so that you know what you can expect from nurses. So there's two parts of the code. The first part outlines nursing values and ethical responsibilities. And that includes, for you non-nurses out there, that includes providing safe, compassionate, competent, and ethical care, promoting health and well-being, promoting and respecting informed decision-making, honoring dignity, maintaining privacy and confidentiality, promoting justice, and being accountable. So I just wanted to highlight two of those points. One is promoting health and well-being, and one is promoting justice. And remember, this is the Canadian Nurses Association Code of Ethics. So this applies to all nurses. So some people might be surprised that health promotion and promoting justice are within the values of all nurses, not just public health nurses. The second part of the code talks about ethical endeavors related to broad societal issues. So this outlines how nurses can focus on improving systems and societal structures to create greater equity for all. So this means that both individually and collectively, nurses need to be addressing those broader societal issues that impact on health. And the code also gives us some ideas of how we can do this. And one is maintaining that awareness of health concerns. So nurses need to be aware of things like poverty, inadequate shelter, food insecurity, and violence, and work for social justice. Nurses need to recognize that vulnerable groups are systemically disadvantaged, and that this leads to diminished health and well-being. And so we advocate to improve their quality of life and take action to overcome barriers to healthcare. And very significantly, this asks for nurses to call on all levels of government to acknowledge the current state of Indigenous health in Canada and to implement the healthcare rights and take action with Indigenous people to improve their health services. So I think it's fantastic that social justice, health equity, and the Truth and Reconciliation calls to action are actually embedded in the Canadian Nursing Association Code of Ethics for registered nurses. And next we have theoretical foundations. So the basis for community health nursing includes a wide range of models and theories, such as population health promotion model, which I'm sure you're all familiar with, and the primary care principles that we just talked about. So the population health model, as you know, includes the social determinants of health, the different levels on which we can intervene, and the Ottawa Charter key action areas. And it's built on a foundation of evidence. And so the population health promotion model is a key theory or model for public health nursing. But public health nursing also takes theories and models from other disciplines. So you can see that public health nurses are very well-rounded in our background and our education. We take theoretical foundations from nursing, theories of change, systems and management, health promotion, and community development, to name a few. So if we're doing a community assessment, for example, we might be taking socio-ecological model to make sure that we're covering all the different levels in that community assessment. If we're working across cultures, we may take the transcultural nursing model from Leninger. If we're working in harm reduction, we might be looking at Wodak's principle of harm reduction. And then there's behavior change and organizational change. There's so many different theories that nurses need to be not only familiar with, but public health nursing requires us to have that ability to apply that knowledge into our practice. I could do a whole lecture just on theory, but I won't. I'll move forward. So knowing that nursing requires such vast key knowledge and critical skills, encompassing public health sciences, behavioral and social sciences, biostatistics, epidemiology, environmental public health, demographics, workplace health, health sciences to understand the prevention of chronic disease and infectious disease, and knowledge that underpins our ability to address psychosocial problems as well as injuries. And incorporating nursing and change theory, economics, and politics so that we understand that broader context in which health happens. We also need to understand public health administration, community assessment, management theory, program planning, implementation and evaluation, principles of population health, community development theory, and history. So there's a lot that public health nurses need to know. So how do we get from where we are to knowing all that and being able to apply it in practice? So people enter into public health nursing in different ways. I had another career, another life prior to entering nursing, but I particularly went to school to study public health nursing. I wanted to become a public health nurse. I had had excellent experiences with nurses in hospital settings and in public health, but there were two experiences that actually kind of drew me to public health nursing. The first was when I had my son. I was living in Hamilton, Ontario at the time, and my husband and I both worked shift work and couldn't make it to prenatal classes that were scheduled. I was young and new to the area, so I didn't have a support system, so I probably would have been considered high risk on one of those nursing assessments that we do to decide who gets home visits. And the public health nurse actually came to our home, and she was able to build in me confidence and capacity as that first time mom in a new community. And I also credit her for informing me about the benefits of breastfeeding, and so I was able to breastfeed my son. The second experience I had when I was living up in Rankin Inlet, Nunavut. At the time, there was a health center where, ironically, you went if you were sick. And there was a public health center where you went for, if you were healthy and you wanted to get checked out, or for immunizations and screenings. And this just made so much sense to me. I didn't know the term yet, upstream, but it just made sense to me that we needed interventions to make sure that people stayed healthy and didn't get sick. And so when my career trajectory changed, I decided to study nursing and to get into public health. And toward my graduation, for those students out there, nursing students out there, I was able to attend a Canadian Student Nurses Conference. And if you have an opportunity to attend these, they're fantastic. And they have exhibits, which are sort of like a job fair. And I went booth to booth and I asked, would you hire a new grad into public health? Would you hire a new grad into public health? And when I got to Northern Health, the recruiter said, I'm not sure. So I gave her my resume and said, well, if you do, give me a call. And at that time, most public health nursing managers were seeking people with 2 years of experience in public health before hiring someone into public health. But shout out to Brenda Fraser from Northern Health. She's retired now, but she decided to hire me as a new grad into public health. And it was a great experience. I went on to study, while I was working in Northern Health, I went on to study the Public Health Agency of Canada Public Health Skills Online. That doesn't exist anymore. But it was a great sort of bridge between public health nursing and when I went on to attain my Master of Public Health from the University of Waterloo. So other people practice other types of nursing before moving into public health nursing, and I've spoken to several public health nurses who worked in other settings and became frustrated seeing the same clients with the same issues who were treated and then sent back to the conditions that made them sick. And they recognized that health happens outside of healthcare and decided that they wanted to move upstream where they could make a real difference. And Trevor Hancock talks about our health system as sick care. And I agree, it is sick care. And we do need sick care. We need to have care when we're sick. But we definitely need to invest upstream to address those causes, the root causes of poor health outcomes. So as a public health nurse, or to get into public health nursing, most public health nurses have a baccalaureate in nursing. As I said, though, now we're getting other professions into public health nursing. So we now have LPNs who are working in public health. A registered nurse in good standing with Provincial Territorial Nursing College, of course, because we are registered nurses. A public health nurse may hold Canadian Nursing Association certification in community health nursing, which is CPHNs, and you'll see my credential. I have that, and I'll talk about that a little bit more when I talk about professional development. And a public health nurse may hold a master's degree in public health or in nursing. So as you've been exploring careers in public health, I'm sure you've become familiar with the CPHA core competencies for public health. If you're not, look them up. They're available on CPHA's website. So the CPHA competencies, core competencies for public health, outlines the competencies to required to meet the core functions of public health. But these core competencies are an umbrella because we recognize that public health involves multiple disciplines. So public health nurses um, adopt the core competency for public health, but the Community Health Nurses of Canada have also developed public health nursing discipline specific competencies. And these reflect the core competencies, but are more specific to public health nursing, so more discipline specific. So the core competencies for public health nursing are shown on the screen here, and you'll notice the differences between the core competencies for public health and the core competencies for PHNs. We've added the nursing sciences because, of course, public health nurses have the public health core competency, but also combine that with nursing sciences. And we've also added professional responsibility and accountability because as a self-regulating body, we have responsibilities to our nursing associations, but also to the public to meet professional and accountability standards. And recognizing that it takes about 2 years, I'm not going to go in too far into the competencies, but they are in the reference section. I do ask that people who aren't familiar with the public health nursing core competencies to look them up. It takes about 2 years of practice to achieve the competencies. And the competencies are an excellent document to be used by nursing students if you're looking to get into public health and public health nurses to reflect on where you are in relation to the competencies and to identify learning plans and learning needs. And I'm very excited to say that the competencies were used in nursing education to ensure that graduates of baccalaureate nursing programs are equipped with novice public health nursing competencies. The Canadian Association for School of Nursing in 2014 published entry to practice PHN competencies for undergraduate nurses. And I'm very excited to see that implemented in nursing programs across the country so that nurses are prepared to function in public health nursing roles upon graduation. So what do PHNs do? We provide a range of, I've been focusing on who we are because what we do changes. Often what we do emerges from the needs that come within the population and within the health system. So we do provide a range of health promotion activities, including prenatal care, immunizations, school and workplace health care, infectious disease control, harm reduction, and chronic disease. We do meet the essential functions of public health that were laid out by CPHA in 2010. So we do promote, protect, and preserve the health of individuals, families, communities, populations, in the settings where they live, work, learn, worship, play, and this can be ongoing or episodic. So our clients are individuals, families, groups, communities, populations, and systems. Sometimes the client is a group within the population who experiences a particular illness or a particular social determinant risk. And we practice in many different settings: health centers, homes, schools, streets, and other community settings. And all registered nurses to some extent, and all public health nurses for sure, address social determinants of health. And as I said, in Ontario, we actually have social determinants of health nurses whose specific job is to address social determinants of health. And using a capacity building and strength-based approach is very important because we don't look for diagnosing illness, but we look also for building on strengths. Human dignity, of course, has to do with how we view people and how we view health. People have inherent dignity, and health is viewed as a dynamic process, holistically involving physical, mental, spiritual, and social well-being. And so self-determination and a sense of connection to community are also very important to health. And advocacy. As I said, one of the models that public health nursing uses is the Ottawa Charter. So we enable, advocate, mediate. We work toward building supportive environments, both multicultural and ecological. We work toward healthy public policies. An example of that would be in comprehensive school health, looking to address healthy policies in the school. Building community and individual resiliency. So when we work with communities and individuals, we're doing with, not for, and part of that is to build that capacity within individuals and empower them to solve their own issues and to have power over their own health. We also are involved in organizing communities towards civil engagement and action and reorienting health and human services. So we always have that view toward continuous quality improvement and improving the systems within which we work. And our nursing and public health values, of course, include inclusiveness, equity, and community development, which is central to all we do. So, as I said, we don't only work in different settings, we also work with different populations. And we might work with people at a particular point in their life course, for example, or with a particular health need or a particular risk factor. So whether we work with specific populations or as a whole, we're always concerned with inclusiveness, equity, community development, and integrating new concepts into our process. And the nursing process, of course, if you're a nurse, you would know, is assess, plan, implement, evaluate. And this goes into everything that we do. Our first thing that we do as nurses is always to assess, and then we move from there. And of course, we use our knowledge, research, that multiple ways of knowing. And public health nurses function very autonomously, so that professional accountability and responsibility is important, and professional relationships. Because we work within multidisciplinary teams, we work with stakeholders, and we work with clients at every different level. So I can't talk about public health nursing without talking about the Canadian Community Health Nursing Standards of Practice. These give us a vision for excellence in community health nursing and apply to community health nurses in every area of practice. And they define our scope of practice and professional standards. And if you're interested in public health nursing, I would encourage you to look these up on the PHNC website. So nurses are embedded in communities and in health systems. So we're uniquely positioned to incorporate health promotion into our practice, collaborating with, as I said, individuals, families, groups, communities, populations, and systems, looking at those root causes, incorporating a variety of sources of information, understanding that broader social, political, cultural, economic, environmental, and ecological context, applying those theories we talked about, and choosing from multiple intervention strategies. And standard 2, of course, we integrate prevention and health protection activities into our practice. These are usually government mandated, like immunizations or communicable disease surveillance and control. But we also look at different levels of prevention and exercise harm reduction strategies. Health maintenance, restoration, and palliation. So we work in harm reduction. We work with people who live with chronic disease. We outreach programs in many areas are saving lives of people who use drugs. Professional relationships, as I said, we work with so many different partners in the work that we do. And capacity building, our goal is not just the outcome when we're planning, implementing, and evaluating policy and program. It's not just the outcome, but we partner with communities with the goal of leaving the communities better off than we found them. So we don't come in as the experts and holders of all knowledge, but we unpack the concepts and translate the knowledge. We give it away so that individuals, families, communities have that knowledge to move forward. And access and equity, of course, we use strategies to increase access, overcome inequities, recognize that health happens outside of the health system, so that's often where we have to work in partnership and collaboration in order to address social determinants of health in larger context in which people live. I just wanted to share a couple of opportunities that I had to work in collaboration and partnership with communities. When I was working in northern BC and the government was reducing the universal home visits for maternal child health, I was able to work with a group of people within my community, Children's First, Success by Six, the library, rec center, Canadian Prenatal Nutrition Program, and other services. And we did a community assessment and identified lots of strengths in the community. But we recognized that in the town where I was living, it was a big oil and gas town. So there was lots of transient families and often young, and they didn't have connection to services. So what we did was we pulled together all the stakeholders and created a coalition and identified the need and brainstormed solutions. And what we came up with were a few interventions. The library set up a family resource desk to give out information to people who needed it. We planned an annual health blitz, which was a health fair for children and families and children 0 to 6. And it pulled together all of the resources and services that were available to them. And we did a mail out package for families of newborns, which included community information as well as health information. And similarly, in Nunavut, I was able to work with a coalition, including the Community Health and Wellness Committee, to do a RV at Youth Sexual Health project. And what we did was we decided what we needed to know, and we partnered with Master of Public Health students on projects. So we had one Master of Public Health student who came, and he did a research project. And our research questions were, what do you know about sexual health? What do they need to know? Where are they getting their information? Where would they like to get their information? And then we brought in another Master of Public Health student to follow up. And she did a program, a very culturally based program based on the needs that the youth identified. And the youth came together and cooked a meal and ate a meal with an elder, discussed the topic, and then had a little bit of discussion with a leader about sexual health. And then because the youth identified that they wanted art and film involved, they did art and film projects to kind of bring back those or sort of reinforce what they were learning. I also have a friend who's a public health nurse who works in as a sexual assault nurse examiner for a local nonprofit. And she has the opportunity to collaborate with hospitals, RCMP, social workers, women who experience sexual violence, and they provide community-based supports and services, including trauma-informed emergency response, liaise between health and justice systems, counseling, training in trauma-informed care for professionals, and linkages to other supports and services. And the Sexual Assault Nurse Examiner program in Nova Scotia is quite different from other programs because most programs across the country are hospital-based and this one's community-based. So that's a pretty exciting opportunity moving forward. So how do you develop PHN competencies and standards of practice? The one thing that I would suggest first and foremost is to join and become an active member in some professional associations. Community Health Nurses of Canada is an associate member of Canadian Nurses Association. It's the voice of community health nursing in Canada. Community health nursing includes public health nurses and other nurses like home health nurses who work in community. Canadian Nurses Association, it used to be everybody was a member, but now I think it's optional for Ontario and Quebec. And of course you're here, so you're probably or hopefully a member of the Canadian Public Health Association. And if you're not aware, your local and territorial public health associations are great ways to link at a local level with other people with public health interests. Benefits of membership are access to journals and resources, reduced rates for conferences, networking opportunities, and opportunities to get involved and exercise your skills in leadership and in population health. Conferences are an excellent way to network and keep abreast of current research and trends in public health and community health nursing. So there's the Public Health Conference coming up in Montreal, May 28th to 30th, and the Community Health Nurses of Canada Conference, June 26th to 28th. I believe that registration is open, and I think there's early bird rates right now. And as a member of Community Health Nurses of Canada or CPHA, you do get a reduced rate for the conferences. Another great way, if you can't afford conferences for public health, is webinars. And a couple that I'll just suggest, and if you have others, please enter them in the chat box. National Collaborating Centers for Public Health often has webinars on different areas of interest, and CHNET as well. So webinars are a great way, usually an hour long, often over lunch, like this one, where they're great learning opportunities. And Canadian Nurses Association certification. Canadian Nurses Association has 21 specialty certification areas now, 17,000 CNA certified registered nurses, and one of the options for certification is community health nursing. So that's something to look into. If you're a member of Community Health Nurses of Canada, there's a study guide that's $50 for non-members, I think, and is free for members. Another way to advance your learning is literature. And as you know, Canadian Journal of Public Health is accessible to members. And the National Collaborating Centers for Public Health also have all kinds of literature that's very valuable. So you nursing and MPH students out there, if you haven't heard of the National Collaborating Centers, you should look them up. There's 6 of them, one for Aboriginal health, determinants of health, healthy public policy, environmental health, infectious disease, and methods and tools. And they're all extremely helpful to students. And finally, Masters of Public Health programs are available across the country. Your considerations for your Master of Public Health when choosing one would be location, because as I said, there are some jurisdictional nuances or differences that would happen in different provinces and territories. So you might consider one that's in your province or territory, or it's not an overly burdensome if it's not. I attended Ontario when I wasn't working in Ontario, and I was just able to kind of apply what I was learning to different places. But some Master of Public Health programs are thesis-based and some are practicum-based. So you'll want to consider, if you have limited or no experience in public health, then a practicum-based program might be best for you. But if you want to go on to a PhD, then you might want to consider a thesis-based program. Some of them have a joint focus, like for example, Lakehead University offers a Master of Public Health in nursing. So those are some options for moving forward. And these are the resources and references that I talked about. These are available from Community Health Nurses of Canada publications. So there's the standards of practice, the discipline-specific competencies, and the professional practice model. So very worth looking into. Other references. And I've also added some professional development links. So the NCCPH, how you find the events there. Oh, and I didn't mention Encore, ONCORE. We used to have public health skills online, but that's not happening anymore. But Encore is sort of a replacement for that. I've also given you a link that you can check out different MPH programs in Canada. So I've included my email address on the last slide. If you have any further questions that we're not able to cover in the time allotted, we're going to take time for questions now. I've also provided the website for the Community Health Nurses of Canada, and you can follow the contact link at the top right of their webpage to contact Community Health Nurses of Canada or to find your provincial or territorial rep. Thanks for taking the time to explore with me a day in the life of a public health nurse. I had a lot of information, and I crammed it in there. Any one of my slides could have been a whole lecture on its own. And finally, I've included here a picture of a hero because I think public health nurses are the unsung heroes of health and public health. There will always be a need for public health nurses, and a strong public health nursing workforce really does stand as a shield to threats to public health. Now we will take time for questions.
That's great. Thank you so much, Deborah, and perfect on your timing. A lot crammed into 50 plus minutes and crammed in a very positive way. So we had one question from Colt Burrows for someone with an MPH and interested in public health nursing. Do you know of any accelerated programs for a Bachelor of Nursing in Canada? And Paul Graham has very kindly provided a link in the chat box to a list of all nursing programs in Canada after degree or compressed programs, and that may be what she's looking for.
Oh, thank you, Paul.
I don't have any other questions. Thanks coming in from some of the participants. Anyone else have a question for Deborah? Just give it a minute if people want to think and type. One of the questions I'll put to you, Deborah, is given your experience, have you noticed over time when nurses who haven't necessarily trained in community or public health have come from perhaps the acute care setting into a public health setting? How is that transition for them? Do you have any insight you can share on that?
Yeah, I think it all comes down to those shared values. And if people have those values, if they're coming into public health nursing because of those values, then it's an easier transition. Often, unfortunately, people will see public health nursing as an opportunity to work 9 to 5 and not wear scrubs, and so that would make for a less easy transition, right? If you're interested in public health nursing because you're really passionate about making a difference, recognizing that health happens outside of healthcare, and wanting to address those social determinants of health, then yeah, that's not a difficult transition at all.
Excellent. And of course, you can't be hesitant about making babies cry, giving them vaccinations, right?
Exactly. My goal was always to make the baby smile again before they left my office.
Absolutely. So a few attendees are still typing, so I'll just give them a minute to see if we get a question in. Is it possible to enter in the public health directly freshly graduated? Oh,
Yeah,
so it's
yeah, freshly out of a registered nursing program. So yeah, the short answer is yes. It might not be easy because there's a lot of competition to get into public health nursing. But just to encourage you that with the with CASN's new standard, baccalaureate nurses are graduating with entry-level public health nursing competencies, which I'm tremendously excited about. And that means that newly graduated nurses should be more ready than perhaps in the past to get into public health nursing. So what you may find is there may still be some old school managers out there who want 2 years of acute experience before hiring people into public health nursing. But more and more managers are requesting are accepting people who are freshly graduated. And so things that you can do to make yourself more marketable as a candidate for a public health nursing position, get involved in community public health associations like Canadian Public Health Association, Community Health Nurses of Canada. Start working on those competencies. Start trying to think about how you can apply those competencies in your practice. Nursing is a reflective practice, so if you can reflect on even your nursing school experience and how you demonstrated public health nursing competencies in your practice as a student, then that all helps.
excellent. And you did a perfect job of answering Lauren Donnelly's question, which was if there was a best way to gain experience in public health in order to be competitive. And I think you covered that off. Now we have a new one from Paul Graham. Thank you so much. Inspired by the heroism theme. First question, read the day-to-day. I heard you mention of maternal work following up with new mothers and settings. In terms of health promotion, is there a role you are seeing public health nurses playing regarding exercise and nutrition? I'm thinking in relation to preventing non-communicable diseases, etc.
Yes, absolutely. I was reading recently about interventions. I know you're talking about maternal health, but I saw interventions with seniors where public health nurses were working with seniors to, I think it was a diabetic focus really, but it was focused on nutrition and physical activity. And so, yeah, so nurses, the first thing we do is assess. So when there's a need for physical activity and nutrition support, either by referral or by providing resources, there's definitely a role for nurses. Yes, absolutely. Thank you for the question.
Great. Now, I see Sharon is typing a question, but we are coming pretty close to time. So I'm going to start some of my wrap up, and then if Sharon gets her question finished, we'll take it as well. So as Deborah mentioned, hopefully you're all members of CPHA. If you aren't, we certainly encourage you to check out our membership in CPHA. If you want to, there's also information there about your provincial territorial public health associations, and there's the link as well that we've provided to the Community Health Nurses of Canada if you are a nurse. So definitely take a look at that. So Sharon's question is, as a nurse transitioning to public health next month, I anticipate a significant learning curve in addition to my learning on the job and mostly self-directed orientations. Would you recommend registering with Encore?
Yes. Short answer, yes.
Perfect. We like short answers when we're in the last minute. So thank you again so very much, Deborah, for joining us today. That was a tremendous presentation, and I think thoroughly enjoyable and very informative for all of our participants. And we had a really good turnout today, so that's great. As Deborah mentioned, CPHA's annual conference is coming up at the end of May. While our early bird rate has closed, there is still a special student rate and lots of student-specific sessions as part of the program that you can check out on CPHA's website. And as I also mentioned earlier, the recording of this will be available later in the week. We'll be sending out a link to it. And it's so feel free to check that out. I've tried to include some links to some of the documents that Deborah was referring to in her presentation. So hopefully it should be helpful. But if you have any questions at all, don't hesitate to email us at CPHA. So if you want to keep up to date on news at CPHA, there's a final link that I've provided on how you can sign up to receive updates about the Public Health Conference and other CPHA goings on. So thank you all very much. Have a great afternoon, and stay tuned for our 2018-2019 webinar series that will launch in September. Have a great day, everyone.